and opinions of the hosts and guests do not reflect those of the station.
Good morning, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. I'm your host, Dr. John Cenica for What's Up, Doc? Good afternoon, Philippines. Yes, we got a new time slot for this afternoon. And of course, together with me is, we have a very hot topic regarding doing procedures to our relatives. And together with me, of course, my favorite and icon in cosmetic surgery, no other than Dr. Ray-RAN. Good morning, doctor.
Good afternoon,
Oh,
Dr. Cenica.
good afternoon.
Yes,
I'm
good
sorry
afternoon
for that.
for
It's
the
already
new
good
time slot.
afternoon.
Yes,
Yes.
and Happy New Year.
Happy New Year
And
too.
Happy New Year to all the televiewers and to all the televiewers of What's Up, Doc. Yes.
Yes, and of course, we have a hot topic. It's like, it's very hard to do there's an emotional involvement in doing a procedures to a relatives.
Yes. And we are talking in English because
Yes, they're from most of them are
guests are
Americans
from the United States.
From the States,
Yes.
right?
Except
and,
for Doctora.
Yes, she's also from the States too.
Yes.
Yes, and of course, doing procedures is like there's an emotion involved and some inhibition, but sometimes you got to do it, and because of the needs. And but most of the procedures that we done to them is aesthetic.
Mostly aesthetic procedures.
Probably some procedures like rhinoplasty,
We're gonna talk about
buccal pads, liposuction,
cells,
and stem cell
yes,
procedures. And it will be very interesting topic because there's some ethics involved too in doing that, and some inhibition. And of course, it's gonna be like a different kind of thing because doing relatives, especially for a surgical procedures, it's kind of be different on the part of the.
When you do a patient that is not your relative.
Right.
It's very different.
Right.
Sometimes they call it if you do a surgery on your wife, they call it a honeymoon syndrome.
There you go. Relative syndrome.
Relative syndrome.
Yeah,
yes.
but it's good that everything turns out nice.
Yes.
Okay, but of course we'll introduce our guest for this afternoon. Okay, I'm not used to say afternoon because we always do it in the morning. And he is from Norco, California. A relative of mine, a brother-in-law of mine. He's the husband of my
He's been
sister.
here, I think, a year ago.
He was also a previous guest of What's Up, Doc, no other than Mr. Johnny Sandoval. Good afternoon, Johnny.
Good afternoon, Johnny.
Thank you for having me. Nice being here. Happy New Year to you.
Yes,
Happy
and
New Year.
of course, I can say my co-host, my daughter, my beautiful daughter, no other than Dr.JOHN Cenica.
Hello and good afternoon. Good afternoon. Good afternoon to all the televiewers.
Very pretty, Doctor.
Thank you and happy 2014 to all you guys and of course all the televiewers. Hindi nga ako sanay na andito ako ngayon as a guest.
Yeah, it's gonna be different kind of angle.
I know, it is.
And we're gonna talk about the procedures.
Oh yeah, and as a guest na ako ngayon, hindi na as a host.
As a host, right.
Yeah,
so
so
we'll be
it's
asking a
gonna be
lot of
totally
things
different.
about you.
I would love that.
Okay.
Sure, my pleasure.
Okay, it's been a while for like 15 years when the first time he went here in the Philippines, and she is a cousin of mine, a first cousin of mine from San Diego, California, no other than Miss Nolita Tulao Ramirez.
Hello.
Okay.
Good
Hi.
morning,
Hi.
Nolita.
Happy
Can I
New
call
Year.
you Knowles?
You can call me anything you want.
Okay, all right. So, yes, because we've done procedures to relatives, especially for us doctors, it's very hard to, there's an emotional involvement, even the judgment during the procedure is going to be different because it's your relatives.
Yes.
So, this is what you call relative syndrome.
Relative syndrome.
And have you experienced to Dr. Lau to do a procedure to somebody like who's very close to you?
Yes, my auntie. My auntie, I did the procedure to my aunt.
Yeah.
And then every day She always calls me. Even at midnight, she always calls me for a follow-up.
Yeah, because you know that. Oh yeah, I know the doctor.
Because
and
my nephew, so I can
nephews
call her
or
any time
you know,
of the day.
because we're close and then we're relatives. So I will not be ashamed to ask any question regarding the procedure.
And you have to do the procedure very well because you will see your relative most of the
For
time.
all your life.
And then the thing is, if there will be any problem, then because your relative is your relative for the rest of your life, you know, so you have to be really perfectly good.
Yes, you will see her every time, birthdays, occasions. You will see your work, so you have to do it very well.
Right. Let's ask Nolita. Nolita, we know that you had a procedure done way back, like how many years ago?
I think it was about 22 years ago.
22 years
Yeah.
ago. I know
Yeah.
you are, after 22 years, still you look good,
And
huh?
it still looks the same.
Okay. So
yes,
what was the procedure then done to you?
Well, it was a graduation gift from when I graduated college.
Yeah.
And I've always wanted to have a nose lift, a rhinoplasm. So 22 years ago, I had it done, and until this day, I'm just very happy to.
Okay.
You know,
you go to school to San Diego State University, is that right?
Right.
Yes.
I went
A
to San
very
Diego State.
nice and prestigious school
So
in
that was
San Diego.
1992, I think.
Yes, very good math.
22 years
Very
ago.
good math.
1992.
Well, see, after 15 years, maybe because there's a lot of patients who's been asking, is the procedure to be done to us will be a lifetime?
Yeah. Is it permanent or
It will be
temporary?
a permanent, right?
So this is a testimonial from a patient that
Yes.
is 22 years ago.
22
Okay.
years, not 15, 22.
So yeah, 22
years.
years. Yeah. Okay. How about Dr. John Cenica? The first person I've heard that she really admitted that there was something done to her in a national television.
Oh.
Okay, Dr. Jonah May.
How many?
Dr. Jonah, we call it Dr. Jonah.
Doctor?
Yeah, I don't think there's something wrong with it. I mean, people are open to cosmetic surgery and, you know, to aesthetic procedures. And yeah, I guess I'm probably one of the few people who are, you know, not ashamed to admit that.
There's nothing wrong with that.
I know, because you know, for me, it's just like, you know, women, we always put on makeup, and you know, just to enhance our features, or probably to make our face look skinny, to have contours, or sometimes you know, women, I'm sure you've heard about this, like we put some brown stuff in here,
there's a nose
brown
lines.
makeup, so you can make your nose a little thinner. And I think the thing with cosmetic surgery is that you're just gonna make it permanent. Like you wake up every day, you're gonna see your face. Oh, I don't have to put makeup. I don't have to put the brown things in my nose because you know, I already had it. So it's just, I don't know, like a three days of recovery. It was 3 days for me. So I don't think there's something wrong with that.
I have a question to Dr. John. So knowing your father, is a cosmetic surgeon. So growing up, do you feel like, oh, I don't care about my looks because my father is a cosmetic surgeon? He will do everything to make me beautiful.
Actually,
did you feel that?
I think
that kind of mentality.
Yes.
I think I was a late bloomer because growing up, even though when I was in college, I never thought of any procedures. Because I wasn't really conscious about how I looked like, because you know, I was having fun with my friends and everything. But when it came to med school and I was being exposed a lot to, you know, to parties, to events that has something to do with cosmetic surgery, you have to face clients, you have to face celebrities, you know, co-workers, and I was getting a little conscious about the way I look, and it was pretty hard for me because I don't know how to put makeup way back. So so one time I just thought of that, Dad, can I just have a rhinoplasty procedures, because I was getting a little conscious with my nose. So sabi nga nila, if you know, if something would make you feel more confident, it would make you work, what do you call this, na mas mabuti kesa than before, it would give you much confidence to work and face other people, then why not? I don't think there's anything wrong with that.
Well said, huh?
Ang daldal ko, no?
Yeah.
I'm used to being a host, so...
Okay, my brother-in-law, Johnny, will be undergoing a stem cell procedure probably next week. And what makes you come over here to the Philippines and to do a stem cell, Johnny?
Well, I've been doing searching on the research on it, and I've got diabetes. I have chronic back pain, and I'm hoping that it'll eliminate the back pain and helping with my diabetes.
So your diabetes is controlled, or
yeah,
do you take any medication?
I take medication. I'm actually on insulin. I walk every day. Try to watch what I eat. Probably not as good as I should, but as a diabetic, it's very difficult because you're brought up and you're used to just eating different foods, and when they tell you you're diabetic and you have to change your lifestyle, you start doing one thing, but maybe you're not doing both, and it's tough.
Stem cells are very good for chronic back pain, especially diabetes. Dr. Cenica did a patient.
We did like
a diabetic patient.
Several patients who had like a diabetes. For the information regarding stem cells is just like we call it regenerative medicine. Okay, wherein it repairs some of the damaged tissue that was made by some diseases, like if you have a problem with the pancreas, some of the we call it the cells, the islet of Langerhans, that was damaged, and you can have like this, because this islet of Langerhans is the one that produces the insulins in your body. And then if it is damaged, there will be like, of course, lack of insulin supply, so there will be increase in sugar. And what does the stem cells do is just like stem cells is just like they have like their own brains, okay? So they know where to go, where is the damaged area. So just like it sends signals to your body that, hey, stem cells, come over here. We have a damage.
If you have a chronic back pain, the stem cells prioritize the place or the area or the organ that is inflamed.
Yeah, it's like here's a Superman. I'm on the way.
Yeah, it's just like that. It's like a rescue team. The stem cells like a rescue team. They go to where the damage is. So we will discuss that later. But okay, let's go back to the procedure that was done 22 years ago, because a lot of patients have been asking, is this procedure done in cosmetic surgery will be like a lifetime thing?
Is it permanent? Do I have to replace this after 10 years?
Yeah, because they say they have like rumors that, let's say if you have a breast dance after 10 years, you have to change it. But I don't think so. It's not like that. So also, having this procedure 22 years, does it really change your life after the procedures?
I don't know if it changed my life, only in the fact that I'm more confident about myself, and I just feel very like fortunate and blessed to just be like more enhanced, and I and then afterwards with the liposuction too.
You get the liposuction,
we forgot about that. And it, just kind of the fat removal, and I think you still have to diet and exercise and really take care of yourself after the liposuction, but it just gives me a lot more confidence in myself.
The liposuction was 22 years ago.
The liposuction was just a couple years ago.
Couple of years ago.
Yes, for our televiewers, you can text our cell phone number 0922-891-6761, and please indicate your name and your location where you are at right now. And you could, we're broadcasting live here at Global News Network, so you could ask any question regarding the procedures that what we're talking about. We're talking about liposuctions here, nose job, WHATS, and probably stem cells. So we're here to answer your questions, and please indicate your name and your location. The telephone number is focused right here on our screen. It's 0922-891-6761. Dr. Lau, we have really a very hesitation, and sometimes you think several times to do a procedure, or probably do you have experience of, I don't want to do that procedure, probably I just give it to my friend to do that procedure, to my relative. Have you had an experience like that?
I had one.
Okay.
I referred it to a friend of mine, but the patient is not a first degree.
Yeah.
It was a second degree.
Yes.
And then I referred it to one of my colleagues, because there is ethics involved, because there is a personal problem among our relatives. So that's why I referred it. But if we don't have a problem, then I'd probably do the surgery.
Yes. Now, Jonah, we haven't asked you what are the procedures that have been done to you. Okay.
Okay.
Is it okay for you to?
Oh yeah.
To mention
I
it
have
to
a-
us?
I don't
Everything?
have a problem with that. No, actually, I had my rhinoplasty done. And my dad actually did my rhinoplasty, which is, I'm very proud of that because I know that Johnson is one of, it's what I believe that, not just because he's my dad, but I believe that Johnson is one of the cosmetic surgery centers here in the Philippines that are very specialized in rhinoplasty. So I was very confident
And more
that
than
time.
20 years in
Yes,
practice.
yes, and it's one of Johnson's specialty that, rhinoplasty procedures. And I was very confident that time to have the rhinoplasty. I didn't have any hesitations. I actually thought about it for just, a couple of days, and I was thinking, yeah, why not? Why not have a rhinoplasty procedure? That was my first procedure to be done.
What year was that?
I was in third year med school. That was probably 2008.
2008.
Yeah,
5 years ago.
Yeah,
That was 5 years ago.
2008.
But
yeah.
still looks good, huh?
Thank you, yeah. And actually after that, I wasn't afraid to go back to school because that was summer. I went back to med school just probably 4 weeks after, and then I had a new hairstyle. I wasn't trying to hide it, but I was trying to, people
To have a new look.
Yeah, to
Not to
have a new
notice
look.
the nose, but to notice the
And
new
I
look
wanted them
only.
to guess what
changed.
What changed.
Yes.
And then my classmates were like, there's something new about you. Medyo blooming ka or something. And I was telling him, okay, you have to guess. And I eventually told them that I had rhinoplasty procedure. And then after that, just recently I had buccal fat removal.
Okay.
So yeah, because I was getting conscious with my
I remember
with my
your
cheeks.
face just like a little bit puffy.
Yes, I had really big cheeks.
Chipmunk cheeks.
Hindi
They
naman
call it
chipmunk
chipmunk
cheeks.
cheeks.
Grabe
no,
ganon.
chip-
Hindi, medyo ganon. Yeah, pero,
Okay.
yeah.
They say that after the first surgery, cosmetic surgery is addictive.
Yeah. What do you think?
Is it true?
You had like
Okay.
several procedures done to you.
Yes,
Is it really true
yes.
that after let's say
The first
a
surgery is
certain procedure, is it
I don't think it's addictive. I think it's like a personal choice, but definitely it just makes you more confident. I mean, like she was saying with the cheekbones, with the buccal fat, I think that's a great thing. And also with the rhinoplasm, the recovery is just like 3 to 5 days initial swelling, and people just like they just notice something different about you, but then you're always smiling. So it's like you're just the confidence that you have in yourself. So.
Johnny, stem cells has also an anti-aging effect.
Right.
Do you consider that having like an anti-aging effect with having a stem cells done to you?
Well, everybody wants to feel a little bit younger and feel better. And
Whether women or men.
Exactly.
Did you tell Kim that you're gonna look younger?
Oh,
after the procedure?
well, I'm going to surprise her. Say, look what your brother did to me.
Probably like you having like insecurities maybe after having stem cells,
Yeah.
No, I'm fine with everything that. Because
So-
I researched it and I'm
I mean,
confident.
is it why not in the States? I mean,
Well,
why the Philippines?
I feel that they're behind a little bit, and what I've been reading, there's a lot of work being done here in the Philippines,
Right.
and a lot of successful work,
Right.
and I mean I trust in you, and I know you're,
Yes.
will
And
do
of
the
course,
best.
a brother-in-law.
Yeah.
That's
It's different when he's your relative,
Yeah,
right?
unless you talk to Kim and I did something wrong.
Yeah, I think there's a certain comfort level, definitely when it's a
Yes.
relative.
Yeah, of
I mean,
course,
for
with the
me,
part of the patient.
I mean, I
right.
would definitely pick a
Feel
family
better.
member more than
Yeah.
a stranger that has, a diploma on the wall that says I did this. But,
Yeah.
living and
That's a good point,
and
yeah.
experiencing life with somebody,
Yes.
it definitely gives you that more security.
Yes,
that
and in
and
cosmetic
trust.
surgery, you let your face to a cosmetic surgeon. You
Yeah.
have to
You
put
gotta
your
trust
trust,
them.
your relative
Exactly.
first.
It's very hard. That's like my patients have been telling me, because when they come to the clinic, it's very hard to trust a person. I mean, it's very hard to have a surgery. You're normally, you're normal. You don't have any pathologic problem, but subjecting yourself to a procedure that you don't
on
really
your
need it,
face.
but plus the procedure will be done in the face. It's
Yeah.
very hard. It's really must be somebody who's really well, 100% trust has to be given.
Yes.
Yeah.
Actually, I should ask you what you felt when I was asking you to do my rhinoplasty surgery.
Before we answer that, we have to post for a few reminders. But after this segment, there will be
an intermission,
a surprise,
yes.
a surprise song from California,
San Diego, California.
Yes, and I will introduce her later and after this first segment. Okay, so we'll be right back when What's Up Doc returns.